Hello, it's Blue Orange 22. So this is something happening in the UK and Ireland. Men are being denied ICU care for the coronavirus, and the healthcare systems in both countries are following an official policy where men are automatically rated as less in need of care than women. Take a look at this document here. So this is a document that came out of the NHS. This is the actual policy that's being used to judge if a patient qualifies for ICU care for COVID-19. Take a look at chart number 1. You can see it's a table showing age and points. Basically, the older you are, the more points you get, because the idea is the older you are, the more likely it is for you to die. Now, the higher the points are, the less likely you are to get it. So it's not more likely to get it, it's you're less likely to get it. If you get over 8 points, you do not qualify for COVID-19. So basically what that chart is saying is that if you're older, because you're more likely to die, it's seen as kind of a waste of time or a waste of space to give you an ICU. Now look below that chart. Look at the turquoise bar. Okay, if you go to chart 1, you go to that table with the age and the points, and then you go to 80, where you can see it's 6 points. Look right below that. You can see that turquoise bar, it says total, sum of the 3 domains above, -1 for female sex. What that means is men are automatically given an extra point. So this is the article. I know some people don't love the Daily Mail as a source, but you will see official quotes in this article. So looking at the title, frail coronavirus patients may be denied critical care under NHS scale system designed to free up ICU beds for those most likely to recover. And then in the article, those with a combined score of more than 5 are said to have uncertainty around the benefits of critical care. Now think about what that means for a second. And then it goes on to say, patients who scored more than 8 points were earmarked to be given ward-based care and treated with an oxygen mask instead of a ventilator. So think about kind of what that means. That first part when it said those with a score more than 5 are considered uncertain if they'd benefit from critical care. Well, why? Wouldn't people more at risk be in more need of critical care? Like if you were more likely to die, isn't that why you need ICU in the first place? And then the second part when it says those who get 8 or more are just earmarked for an oxygen mask instead of a ventilator. If you go and you look at that chart again, you'll see that it's not very difficult for a man to get an 8. Actually, it's very difficult for a man not to score an 8 if he's 70 years old or over. If you have high blood pressure and you're a man 70 or over, you have 8. So you're cut out from ICU automatically. Now, first of all, just imagine if this were reversed. Imagine if it came out that the guidelines were to give women an extra point so they were less likely to qualify for ICU care. Just imagine the outrage. Just imagine what feminists would say. And imagine if that's the way it was and the death rates were equal with men and women. But that's not even the case, because what I think is especially unfair about this is, remember, men are more likely to die from coronavirus than women are. Men are 70% of deaths of corona and have double the mortality rates overall. But yet they're the gender that are given less care and are less likely to qualify for the ICU. That makes no sense at all. Now the reasoning that they give, again, it's the same logic as with older people. Well, if someone is more likely to die, then we shouldn't waste the effort trying to save them, or we shouldn't waste the ICU because they're less likely to survive anyway, so let's not give them the ICU care, let's not give them the intense treatment. I think that argument is completely ridiculous, and it makes absolutely no sense whatsoever. If anything, it's the other way around. If you have a group that's more likely to die, wouldn't they be the group that needs more care, be more appropriate for intensive critical care? But that's not the way it is. But you absolutely know If the genders were reversed, that would absolutely not be happening. In fact, they'd probably be doing the same thing. They'd probably say, if it was women who had the higher mortality rate, they'd probably be saying, well, because women are more likely to die, they should be getting the extra care. Because women are more at risk, they should be getting the extra care. I bet you, if the mortality rates were reversed, we'd probably see exactly the same thing happening. It just kind of goes to show you why we need a men's rights movement, because this is something that is a publicly funded, tax-paid healthcare service, and this is the only healthcare service in the UK. So these are the only options that a man has. If he doesn't have enough points or low enough points, he doesn't get an ICU and he's left to die. This is the actual policy, and in my opinion, it's very scary, and not to mention completely sexist. I put a link down to the article below. You'll see the NHS is denying it, but this has been going back and forth for a few weeks now. This chart obviously came from somewhere. And I actually hopped on Reddit and I went to a couple UK forums and I asked around and I said, does anyone know if this is real? And I did hear from people who worked in the NHS and said, yes, actually, this is real and it's used to varying degrees. I am going to do more videos on this. Ireland is doing it too. I'm going to cover how Ireland is doing it as well. And I'm going to see if I can get any interviews or find anyone else that has direct experience with this and share their experiences. But anyway, read the descriptions in the link below. I think this is very serious. This is an example of men being directly treated in an inferior way under law.